going on this very, very special mission. We don't have a barracks where the Guard is waiting. They live their lives. So each person here who is being deployed that you're seeing today has left their family, left their home, left their job, or left their college. So this is a big sacrifice from them, big sacrifice that they are making, and we appreciate it very, very much. I wanted to just be here personally to thank them for doing that. National Guard, when we think about the deployment of the National Guard, I guess before I get to the other tornadoes, floods along the Ohio River, other natural disasters. The National Guard throughout this pandemic has played a crucial role. Early on, when homes that would normally man food banks could not go, National Guard went and kept the food banks and kept the food going. National Guard was involved very early on in testing. And they became involved in giving vaccinations. We've had the National Guard go into places where sometimes people who were there didn't have access or as much easy access to the vaccinations. Fran and I have been in places where the National Guard has come in. We've asked them to come in and go to high-rise elderly housing, senior housing, and other places. So they continue to play a major role. This deployment over 2,000 members of the Ohio National Guard is different. This is into our hospitals. The role is to keep our hospitals going. All of us depend on our hospitals to protect us, and now the National Guard is involved in protecting our hospitals and enabling them to continue to protect all of us. Fran and I, as you saw, talked to a number of members of the Guard, and they're doing all kinds of different things in their life. Construction, HVAC, a teacher, all kinds of different things. A number of them were students. So we just appreciate what they're doing. We hope to get them back to their regular life as soon as possible. But each one that we talked to, had the attitude, this is our mission, and this is what we need to do. I'm going to ask the General Harris to describe kind of where we are in regard to this. They're finishing up really the deployment of the second tranche of members of the Guard, and they're getting assignments today, and then we'll be in hospitals tomorrow. General?
Thank you, sir. Sir, if I could, I'd like to first start by thanking those of our healthcare community. One only needs to go into the hospital for one visit to realize that the anecdotes really don't do justice to what's really happening in our hospitals and the strife that they're experiencing right now. And many of those healthcare workers that have been in the trenches for 22 months and working tirelessly, and they're tired, and they're overworked, and they're overwhelmed. And when you walk into an emergency department and see patients in beds in the hallways waiting for rooms, you realize the significance of the crisis that's occurring in our healthcare system right now, which is why we're here. And today we're in the process of finishing up the second wave of the mobilization, which is another 1,250 individuals to come on duty to support these hospitals and help alleviate the crisis. In short, our role is to help expand the capacity, help the clinical staff in the hospital create more bed space so that they can continue to take care of Ohio's sickest patients and ensure that when people come into hospitals, they get the level of care that they need. We're doing that in a variety of ways. One of the most important things that we're doing is standing up testing sites, and we're in the process of standing up more as we speak, because we know that people are going to the emergency departments in the hospitals for nothing more than to get a COVID test, and we need to relieve that stress. So we're establishing testing sites in the vicinity of the hospitals, but to relieve that pressure on the hospitals so that the emergency departments can take care of sick and injured people. Our service members are doing tasks, everything from being sitters, keeping eyes on people in the hospital that need to be observed, to helping in the environmental services department. Beds are so vital the ability to turn beds quickly and get people out of the emergency department and into those ICU beds or other beds in the hospital is critical. So our folks are helping turn those beds as quickly as possible. They are helping with general administrative tasks and anything else they're asked to do in those hospitals that can free up those clinical staff to go staff beds so that the healthcare system can continue to take care of Ohio's sick and injured people. And that's exactly what we're doing. So right now, the preponderance of our forces are arrayed across the northern end of the state. I'd say that 65% of the people we have out there right now are across that northern strip, what we call Zone 1 in the healthcare vernacular. Zone 2 probably has about 20% and about 15% down in the lower half of the state. Now, we do anticipate that shifting. We work very closely with the Department of Health and with the Ohio Hospital Association as we surveil this disease and watch what's happening with it. We want to maintain the ability to lift and shift our forces as necessary to provide the support where it's most needed in the state. But right now, that's in the northern part of the state, and that's where the majority of our forces are arrayed. I couldn't be more proud of our soldiers and airmen who've shown up. Nobody signed up to do this when they looked at the recruiting poster and decided to join the military, but they've come and they've maintained a positive attitude, and the reception that they've received when they've gone into the hospitals has been extraordinary, absolutely extraordinary. Even more compounding is the fact that, of course, they did this over the holiday season, and quite frankly, when we called them, they didn't flinch. When the governor said we need them, when the healthcare system said we need them, Governor DeWine said, "General, move out." I will tell you, I couldn't be proud of the way our soldiers and airmen responded.